Uh, First of all, welcome everyone. This is our third statewide webinar, and it's sponsored by Special Needs Network and Autism Deserves Equal Coverage. And we've been doing these webinars since COVID-19 hit because we wanted to be able to really address the autism and the disability community. We wanted to bring the community speakers who were involved in developing some of the state policies that govern the delivery of services during the pandemic and during this state of emergency that's been called both by the governor and by local elected officials. So thanks to everyone that is joining. This is, again, I said this is our third webinar. We are going to continue to do these because we want to make sure that the entire community, families and providers and agencies feel supported and that everyone gets the information they need so that their children, their teens, their young adults are really thriving during this period. We know how difficult it is. Everybody is doing a gazillion of these Zoom calls. So thank you for all of you who are, signed on today. We had a tremendous response. All of these webinars have been really, really well attended, which demonstrates to us what the need is in the community for us to come together. So the calls are definitely for our presenters to answer questions, but it's also an opportunity for us to just come together as community. So, this is not going to be an opportunity for you to get every question you've ever had answered by these experts. It is an opportunity, though, for us to ask them questions and for them to provide information that hopefully will help you better understand what the state's response is to the COVID-19 public health crises. If there's some questions that don't get answered, don't worry. You can send us an email. You can put it in the chat box and we'll try our best to get your questions responded to. But like I said, most importantly, for our Special Needs Network, this is all about creating a virtual community because we've had to shutter all of our programs. Those of you that know Special Needs Network know that we give huge events in the community where we have literally thousands of parents come out to various health fairs and resource fairs. We have our big autism conference. We have our summer camp in July. We have our back to school event in August. And based on the new shelter-in-place orders issued by LA County, not likely that we'll be able to do any of those programs in person, but we've made a terrific effort to transport our in-person programs online. So we've been offering online training programs to parents. We've been providing lots of other content for our community, from yoga to dance to flower making, just all kinds of things to make sure that the community knows that we're here for you. We have a 24-hour emergency hotline. So if you are having issues, whether it's stress and feeling overwhelmed, or have questions about your ABA services, or you just need to get information about unemployment or a stimulus check or whatever issue you may encounter as a family, we are here for you. And please take advantage of the resources that we have assembled. I'm so grateful to our sponsor, our co-sponsor, Autism Deserves Equal Coverage, and our additional co-sponsors, Behavioral Autism Therapies and Autism Business Association. Thank you for your support of these webinars, and thank you for all that you're doing in the community to support families. So with that, we're going to get started. The format's pretty simple. I'm going to introduce our two presenters, the representative from DHCS and a representative from CDE. I'm going to then give them an opportunity to make a presentation, and after the presentation, you can ask questions. We have some questions that have been sent to us in advance. We'll get to those first, and then we'll take questions from the participants. So with that, I'm going to start with our first presenter. Her name is Autumn Boylan, and she is the Assistant Deputy Director for Integrated Systems in Healthcare Delivery Systems at the California Department of Healthcare Services, known as DHCS. As Assistant Deputy Director for Integrated Services, Autumn provides strategic direction and implementation support for Medi-Cal's healthcare delivery systems, services, and programs, including California Children's Services and the Home and Community-Based Services waiver programs. She has over 10 years of experience in the state of California and has been with DHCS since 2015. Autumn has a master's degree from Drexel University and a bachelor's degree from San Francisco State University. So welcome, Autumn, and thank you so much for joining us. And I know you have a presentation prepared and you want to share your screen, so I'll give the floor over to you, Autumn.
Thank you so much. Hopefully folks can hear me. Let me know if you cannot. I really appreciate the invitation to be here with you this evening and to share a little bit of information about what the Department of Healthcare Services has been doing to address the COVID-19 public health emergency. I'm going to pull up my screen so that you can see some slides that we put together. But first, I just wanted to start off by saying thank you so much, not only to Special Needs Network, but to all of you for being here tonight and for your interest in the department's efforts to address the COVID-19 public health emergency. We know that this has been a particularly difficult and unique time in the delivery of healthcare services for us as individual people, for us as families. This is just the first time in my time with the state of California where I'm sitting in a room in my home as I'm presenting to folks, because we can't all be together in the same room. And as, you know, not only as a professional, but also just individually and personally, I understand the difficulties that this and the challenges that this can pose for us as people and for families as well, and for providers and everybody who's involved in the delivery of care and services for vulnerable populations. So just really appreciate all of your time. Recognize that this is a difficult and challenging time, and we're all kind of in this together, and with the leadership of our governor have been really making good strides towards you know, preventing further spread of COVID-19, but certainly there's a long road ahead of us as we continue to combat this pandemic, but also as we work together to make sure that, you know, we're able to rebuild our healthcare delivery system, to make sure that services are available for families and for you all who so rely upon our healthcare delivery system. So just wanted to kind of start with an acknowledgement that this has been a challenge and a very difficult time. I've already been introduced, but my name again is Autumn Boylan. I'm the Assistant Deputy Director for Integrated Systems at the Department of Healthcare Services. And I've only been in that position for a short time, but as Ms. Martin said, I've been with the Department of Healthcare Services for several years and look forward to sharing some information with you tonight. There's only a few slides for us to review tonight. I know that you'll have questions, and we want to make sure that we leave plenty of time for that. But I thought I'd start with a brief overview of the Medi-Cal program, talk about some of the benefits that are available for children and families under the Medi-Cal program, as well as kind of focus on some of the particular flexibilities and guidance that DHCS has issued as a result of the COVID-19 pandemic. Excuse me. So as you may know, the Department of Healthcare Services is the single state Medicaid agency for California's Medi-Cal program. In California, we call it Medi-Cal, but nationwide, it's the Medicaid program. And the state, through the Medicaid program, administers approximately $100 billion annually in public funds that support the healthcare of more than 13 million Californians. So we have more than 13 million people are enrolled in the Medi-Cal program and receiving their care through the services provided by the Department of Healthcare Services. Medi-Cal is a public insurance program which provides healthcare services to low-income individuals, including families, children, seniors, and persons with disabilities. And the services are financed through a partnership between the federal government and the state of California. There are multiple types of, and I've been given the slow down sign, so I will try to do that. There are multiple Medi-Cal programs under the umbrella of Medi-Cal, including Medi-Cal Managed Care, Medi-Cal Fee-for-Service, Home and Community-Based Services Waivers, which includes many of the programs that children and families receive services through the Medi-Cal program, specialty mental health services, and drug Medi-Cal and drug Medi-Cal organized delivery system services. There are, of the more than 13 million people who are enrolled in the Medi-Cal program, a majority of those, or 10.8 million people approximately, are enrolled in Medi-Cal managed care. And Medi-Cal managed care is in all 58 counties in California. And there are 6 different models of managed care. So depending on the county where an individual lives, there may be a different model of managed care that they are enrolled in. And for those folks who are not enrolled in a managed care program, there are services available through the department's fee-for-service delivery system or through the waivers that are listed on the screen. There are different types of benefits that are available for children. This is not an exhaustive list that I'm going to share with you tonight, but we did want to share some prime examples of services that are available for children under the Medi-Cal program, including the Early and Periodic Screening, Diagnostic and Treatment Services Program, or EPSDT, which falls under federal rules for making sure that children are able to receive a high-quality array of preventative services, such as screening services, diagnostic and treatment services, and basically that's up to the age of 21, and it's a comprehensive array of services that are available under the EPSDT program. The services are covered without cost to the beneficiaries, and the Medi-Cal program covers all medically necessary services, regardless of whether those services are identified in our state plan for children, if those services are necessary to correct or ameliorate a child's condition. It also covers preventative services, wellness checks, immunizations, and those types of services under EPSDT. We also, at DHCS, under the Medi-Cal program, have a benefit that you're all probably very familiar with, which is behavioral health treatment, which is a service that covers treatment for eligible beneficiaries, again, under the age of 21. And this may include children with autism spectrum disorder, as well as children for whom a physician or psychologist determines that behavioral health treatment services are necessary. These services might include applied behavioral analysis or a variety of other behavioral interventions that have been identified with evidence-based approaches that prevent or minimize the adverse effects of behaviors that interfere with learning and social interaction and promote to the maximum extent practicable the functioning of a beneficiary, including those with or without autism spectrum disorder. The services include behavioral interventions, cognitive behavioral interventions, comprehensive behavioral treatment, language training, modeling, natural teaching strategies, parent-guardian training, peer training, self-management, and social skills, as well as other interventions. Services are available both through the Medi-Cal managed care delivery system as well as the fee-for-service delivery system from the local regional centers in each county. The state also provides dental benefits for children to make sure that necessary preventative care is provided for folks related to their dental health. Oral health is very important, and it's a critical component of a person's overall health. So those services are also covered under the Medi-Cal program, as well as the California Children's Services Program, which provides diagnostic and treatment services, medical case management, physical and occupational therapy services to children under the age of 21 who have eligible conditions under the California Children's Services Program. This program also provides services delivered at public schools, including medical therapy services, occupational therapy, and physical therapy. Approximately 70% of children who are a part of the CCS program are also Medi-Cal eligible and receive their benefits through the Medi-Cal program at large. The remaining children receive services through the California Children's Services Program only in a partnership between the state and local and local government. We also have other services available, including mental health and substance use disorder services for children, youth and families, adults as well. Those services are delivered by county behavioral health departments and are carved out of the larger Medi-Cal managed care program. Again, those services are available in all 58 counties across the state of California. And finally, services are provided. We wanted to highlight that home and community-based services waiver for developmental disabilities and regional center services. That program, although it is a part of the Medi-Cal program, it is administered by the California Department of Developmental Services, who I understand has previously presented to this group. And they are responsible for authorizing home and community-based services for individuals with developmental disabilities through the regional centers. There are 21 regional centers throughout California who purchase and coordinate services and supports for individuals with developmental disabilities. As a result of the COVID-19 pandemic, the department has worked very closely not only with our healthcare delivery system partners like the Department of Developmental Services, Department of Education, California Department of Public Health, Department of Aging, and others. But we've worked very closely also with the Centers for Medicare and Medicaid Services to identify necessary flexibilities in federal law to permit California to operate with this flexibility that's needed as a result of the COVID-19 pandemic. So we worked pretty quickly. We once the governor's executive order was issued, and even prior to that, to identify critical flexibilities that would be needed in the Medicaid program for us to be continuing to provide necessary services for children, families, adults, and older adults. Some of the flexibilities that I'm going to highlight today are, I'll go into a little bit more detail, including flexibilities related to telehealth, well-child visits, and preventative care, et cetera. But there are many, many other flexibilities for which DHCS has requested waivers so that we can continue to ensure that medically necessary services are available for beneficiaries who need those services. And there's the last slide that you're going to see today will have resources that you can click over to link to all of the guidance that DHCS has published related to the COVID-19 pandemic, which is fairly extensive. For today, though, we wanted to highlight those that we thought would be most important for this group to hear about, including telehealth, which is where I'll start. So CMS has granted fairly broad authority to states to implement telehealth for the Medicaid covered services during the public health emergency. That was one of the first areas of guidance that CMS issued to states, and they issued in the form of blanket waivers for all states to be able to implement telehealth to the extent possible for the delivery of healthcare services. That's probably what many of you are experiencing, whether you're a provider and delivering services via telehealth or a family member who is working with a provider to make sure that your child receives services during this period of time. Obviously, it has been, there's been a lot of guidance both from the public health sector as well as from the Department of Healthcare Services to limit in-person contacts as much as possible in the delivery of healthcare services. And telehealth has been a critical tool for making sure that services are continuing. DHCS issued guidance for Medi-Cal managed care plans and fee-for-service providers regarding the use of telehealth as an alternate means of providing these critical medically necessary services. And while some services can still be delivered via an in-person visit with appropriate precautions, telehealth is the preferred method for delivering services during the COVID-19 pandemic. If telehealth is determined by the provider to be an appropriate mechanism for delivering care. DHCS recognizes that traditional telehealth modalities might not work. And so we've also expanded the flexibilities to allow for telephonic interaction or other means of providing services that may not otherwise be allowable under the Medicaid program. And those flexibilities have been also widely kind of touted by CMS on the federal level as well. Under limited and extraordinary circumstances, DHCS recognizes that practitioners may need to use other types of communication platforms in order to communicate effectively with people who are in their homes. And so those modalities are permitted as a result of the COVID-19 pandemic. There's been guidance and a lot of discussion with managed care plans as well as our fee-for-service providers about how to deliver such care, and the services are to be provided and reimbursed at the same rate, whether the service is provided via telehealth or in person as a result of this guidance. Virtually all benefits under the Medi-Cal state plan are available via telehealth with very few exceptions, and we really do encourage folks to utilize telehealth, reach out to your providers. Providers should be reaching out to their clients and delivering care so that there's not a discontinuation in services, and those services can continue without disruption. We've also recently put out guidance regarding well child visits and preventative care. This has become a big topic of discussion as of late within the department and with our partners. We recognize that it is critically important for children to continue to receive their well child visits as well as immunizations. And so we've put out guidance, but really do emphasize with our providers and our partners to make sure that those visits are continuing, because we do recognize that it is critically important that children are meeting their milestones and that parents are able to get information from their providers throughout the developmental process. We do also recognize that parents might be cautious about taking their children in for well child visits during this time. You don't want to expose yourself or your child or your provider to further exposure of COVID-19. And so we've put out guidance that allows for most components of the well child visit to happen via telehealth, and provided some guidance around how those visits should occur and how they can be reimbursed. There's also been guidance put out by the American Academy of Pediatrics and Bright Futures that are really kind of the guiding elements for how services should be provided via telehealth during the pandemic, particularly for these types of well child visits. Although pediatricians might limit the in-person visits, the guidance encourages clinicians to prioritize in-person care for newborns, as well as visits and immunizations for infants and young children through the ages of 24 months whenever possible. And we encourage providers to consider the risk of COVID-19 exposure when engaging in in-person visits, taking all necessary precautions to make sure that children and families are safe in the physical space, and that services are provided, but in the safest manner possible. DHCS also issued guidance related to waiver flexibilities that were requested for the Home and Community-Based Services Developmental Disabilities waiver. Because that waiver is a 1915C program, we were able to pretty quickly secure flexibility from the Centers for Medicare and Medicaid Services related to the provision of services under the waiver. The waiver provides behavioral intervention services, community living arrangement services, day services, homemaker and pre-vocational services, respite care, supported employment, home health aides, occupational therapy, physical therapy, psychology services, speech, hearing, and language services, as well as a host of other services. In order to prevent potential exposure from COVID-19, DDS has authority under an approved Appendix K flexibility to allow temporary changes in service locations for services such as day services to be provided in a participant's home. They're allowed to temporarily modify provider qualifications if a participant decides to self-direct to an individual to provide services, as long as the individual is at least 18 years of age and possesses the skills and experience necessary. There's also flexibility to temporarily modify state service plan development requirements for an in-person attendance of service plan development and monitoring meetings, and allow the option for telephonic or live virtual video conferencing in lieu of an in-person visit. And there's also been authority granted to make retainer payments for habilitation, behavioral intervention services, and day services due to absences that occur as a result of the public health emergency. The department has also put out guidance related to the provision of CCS services that allows for California Children's Services to continue to be delivered without delay during the public health emergency. All of the policies issued by DHCS that apply to the fee-for-service delivery system also apply to our California Children's Services program, and that is reiterated in the guidance that was put out. And in light of the public health emergency and all of the other guidance that we've put out for Medi-Cal programs, the guidance also really encourages the use of telehealth for the provision of CCS services. And the flexibilities that are outlined in the guidance apply to all participants of the CCS program, whether they are participating in a Medi-Cal managed care, whole child model county, or in a fee-for-service county, and they're not enrolled in a managed care program. Just two more quick things that we wanted to provide some updates on. Regarding Medi-Cal eligibility redeterminations, CMS has granted flexibility, and DHCS has delayed the Medi-Cal redetermination processing to ensure that members continue to have access to services. Medi-Cal beneficiaries with upcoming redetermination dates will not need to start the redetermination process during the pandemic. And for Medi-Cal managed care members, the redetermination dates will remain the same, and existing managed care members will continue to be enrolled in a managed care plan throughout the duration of this emergency. For services that require prior authorization, DHCS received approval to waive or modify prior authorization requirements during for the duration of the public health emergency, and as a result, for all Medi-Cal covered benefits in the state plan, which are currently subject to prior authorization, DHCS has suspended prior authorization requirements, but does still require a treatment authorization request or a service authorization request if they are required for the delivery of services. However, the TAR or SAR may be submitted after the date of service so that there's not any barriers to the delivery of services. I do believe that Special Needs Network will be sending out the slides following tonight's presentation. And as you may be able to see, all of each bullet is hyperlinked to the guidance that is published on the DHCS website. So if you'd like a little bit more information about the flexibilities that are available, as I've just highlighted, I've linked to the guidance so that you can review that. And certainly if you have any questions and follow up to this, you can get in touch either with Special Needs Network or reach out to me directly, and my contact information is also on the slide. Lastly, I just wanted to share that we've also hyperlinked to some COVID-19 resources, which may be of use not only for you as individuals and families, but also for the providers who are joining us tonight. The California COVID-19 webpage is the page that's operated by the governor's office, which has extensive information about California's response to the COVID-19 pandemic. DHCS's COVID-19 webpage also has tons of resources about all of those flexibilities that I've been sharing with you, as well as many others related to the public health emergency. The California Department of Public Health has a ton of resources available about how to stop the transmission of COVID-19, how to protect ourselves and our communities, as well as just a ton of other public health information. They are a really great resource for information about the COVID-19 pandemic, as well as a link to the Centers for Disease Control and Prevention, where there's additional information. I was going to open it up here, but we may be pausing until the next presentation and having questions at the end, but my contact information is here on the slide, autumn.boylan@dhcs.ca.gov. As Ms. Martin said in the beginning, if you have questions that are not addressed tonight, we'll be happy to address questions following tonight's presentation. Thank you so much for having me. And again, appreciate all of your time. I hope this was useful information that we've shared with you, and we look forward to your questions.
Thank you so much, Autumn. Really fantastic presentation. Autumn is going to stick around and she will be available to answer questions. I just realized I forgot to tell you who I am. So I'm Areva Martin, and I'm the founder and president of Special Needs Network, and I'm one of your moderators. And joining me is Kristin Jacobson, and she is the founder and president of Autism Deserves Equal Coverage, and she's also one of the moderators tonight. She's going to get started on the questions after I introduce Kristin and she gives her presentation. So thank you again.
I'm sorry, Areva. One more thing, I'm sorry for the translator. Kristin, if you could just speak slowly and clearly, because the translator was having issues hearing. So just keep that in mind.
Okay, great. Thank you, Connie. And yes, we are happy that this presentation is being delivered in both English and Spanish, and it's being recorded. So we will be able to provide this information to folks after the call or after the meeting. So next is Kristin Wright. Kristin Wright is the California State Director of Special Education, a role she was appointed to on September 1st, 2016, and reappointed by Superintendent Tony Thurmond in 2019. She is the daughter of 2 public school teachers. She entered the education space when her own daughter, Shelby, was born with significant disabilities. Her appointment by the California State Senate to the Advisory Commission on Special Education in 2006 brought her into the state in terms of the work that she's doing currently. Kristin returned to pursue higher education and to earn an education specialist teaching credential and a master's degree in special education. She has spent 2 decades working on education policy and programs with the focus on special education and improving outcomes for students with disabilities. So we are grateful to have Kristin here tonight. She's, as I indicated, the State Director for Special Education. And we wanted to bring Kristin and Autumn together because so many of the ABA behavioral health treatments that our kids receive, there's overlap between what's provided at home and in the school district setting. So with that, I will turn the floor over to Kristin Wright.
Thank you, Areva, for having me, and hello, everyone. Welcome to my back room that, as a parent, I was trying to set up a place where my daughter could come and do some of her interactions with the people that she usually spends all day with out in the community, and she's 21. And unfortunately, she doesn't want to come in this room anymore because, like probably many of you, she doesn't see someone on the screen as someone who's a real person. She's used to seeing movies on the screen, and even though her favorite people are on there, it's not quite the same. And I think that's what a lot of us are experiencing from the parents that I've been talking to as well, is when you have a child who gets, 24-hour-a-day support, and you don't have people anymore that are doing their regular routines in the community, especially when you're doing activities like employment. Sorry, slow down. When you're doing activities like employment-related activities and you're not at a job site or out in the community working on those job skills, this can be very challenging. And so living it here at home as well, and trying to figure out what that might look like while we're trying to look at it from a policy level as well. So I'm going to talk a little bit today just about where we are as a state around requirements around the Individuals with Disabilities Education Act and how the state's looking at that. And then I want to show you some of our resources on a couple of the websites that we're putting everything. And I don't know if Autumn would agree, but everything that we're doing really is in coordination directly with the governor's office. So all of the guidance that we put out as state agencies, there's really a concerted effort and alignment across our entities all the way directly with the governor's office to make sure that we're all consistent with what the law is and what we're saying so that everyone knows where we stand. So I'll talk about a few things first. Number one, and I think most importantly, is that the Individuals with Disabilities Education Act is still in place. Nothing has been waived in that act. So those civil rights and protections still travel with our students and our children around their education. But I will say that a free appropriate public education, which is one of the guarantees in IDEA, in FAPE, the FAPE in the least restrictive environment in schools looks very different than FAPE during COVID, because we don't have a lot of the same in-person options. And I know this really impacts students with autism and their behavioral aid situation, because we're used to having people, and not just people on a screen, but people really being available to work directly with our kids. So while the IEPs that we all did over the last year to enact this year are still technically in place, we've pivoted to we're going to look at those IEPs and do as much as we can within those IEPs in the context that we're living in, which may not look like the same amount of instructional aid support or related services. So sometimes just because our own children can't do it for as long as they could if they had a person with them. And I don't know about you, but my daughter doesn't want to do an hour of speech therapy, 3 times a week on a computer, whereas she may be able to do 15 minutes in increments or something. And so we've had a lot of questions about the fact of whether or not, if you had 3 hours a week of speech, let's say, on your IEP, and you're only currently doing 3 15 minutes instead of 3 1 hours, does somebody owe someone hours? And the answer to that really depends on the individual situation. There is no dollar for dollar trade-off in an IEP. It's not like you receive this many hours in your IEP and you have to get this many during COVID, because really what we're looking at is a situation of, this isn't a typical situation, and no students are getting their full education. And so what happens is it really becomes an agreement between the family and their school district and their teachers and their instructional aides and everyone who's working with that team to figure out what can work for the student. We in our state still have, as of last week, I think around 1 million students who are not connected. So there's still work being done after the 7 weeks we've been in this process to try to make sure that everyone has a device and has connectivity to be able to get online. And so, there's some sort of original hurdles that have to be overcome. And I've talked to some families who have been doing, a lot of their related services through the parent's phone, or some of our rural counties, some of the families, don't have any connection at all, but maybe a phone line where they're getting some related service help, from their providers with coaching the parent. And as we all know, in terms of this whole equity conversation, there are many challenges that families are facing, and to many different degrees. And so I think as a state, we're looking at what types of how can we all together be flexible, understanding that some places in the state have more stringent orders around in person. Most everyone is still on shelter in place to a certain degree. And then as that starts opening up, we have to start having those conversations for each individual student's IEP team about what that looks like moving forward. So there isn't like a blanket, like, this is what everyone has to do right now. This is about really good communication with your school teams about we're all doing the best we can. Because as we know, a lot of our teachers are also at home full time with their families, just like we all are, trying to do our own childcare and having, you know, trying to help everyone else. So so we're looking at a deep level of understand. I'm talking too fast. I'm sorry. Thank you, Kristin. We're looking at a deep level of understanding is my point. And as a parent, I'm trying to take that same approach. And so a couple things you should know legally about what your rights are. The first one is that your right to call and to ask for an IEP is the same as it ever was. So if you're in a district and you've worked out some of your distance learning, and you feel like it's not going well or something needs to change, you can always call an IEP. And that's no different now. Your IEP will likely be remote. It will be, you know, either on Zoom or on something else, on FaceTime, whatever your district is using to do their IEPs. But you are always welcome to, and the same laws apply around IEPs. Now, the second thing that you want to know is that that things are ever changing, right? So I think when we first started this, we thought we were doing this for 2 or 3 weeks. So some of the things that we all decided about our plan, our program, seemed really temporary. Now it looks like things might be going on a little longer. So what do we do now? So this is a time to, again, you know, make sure you're talking with your team and you're looking at the future. Some folks may have extended school year, some may not. Some may be looking into the fall about, you know, what is my child's program going to look like? And it's going to depend on local health is the first underlying priority. What is the local health ordinance and shelter in place and all those things saying first? However, districts and schools are still open. And so the expectation from the state is that students are still provided services and supports to the degree that they can during COVID. And so that's a delicate balance. And so we've received a lot of questions about, what do I do if I've tried to talk to my district, I've tried all these avenues, and I still don't feel like I'm getting support? You're always welcome, just like you have always been, to call and file a state complaint. But what I would recommend is, first, you talk to your child's teacher, you talk to your program specialist or coordinator, you talk to your school principal, talk to your special ed director in your district, you talk to your SELPA director if you feel like you still can't get resolution. But it's always better to try to go at the local level, because they can actually get you some type of assistance quicker than the state coming in and doing some larger long-term, you know, open complaint or investigation. So it's always, you know, we always try to help figure out how we can make it work out as fast as possible for the student, especially if you feel like your child is in danger, or that, you know, that things are, that something needs to change. And I know with the change to non-public schools and agencies to having to go remote, that has been very challenging for a large population of our students. And I know our students with autism and other developmental disabilities. It's been very challenging. So I want to take you now to a couple websites. Can I share my screen? Okay. Can you see my screen now?
No. Yes.
Okay. So this is the California Department of Education website. So basically it's just your cde.ca.gov. And you'll see over here, let me move this down. You'll see over to the side this coronavirus COVID-19 response. If you click on that, you'll go to our department webpage. And this has all kinds of information around, it's updated regularly, around distance learning and all the different parts of the Department of Education. In the Special Education Division, we're responsible for the 795,000 students with disabilities in California. That is our purview. And we do that through working with our local educational agencies, our school districts, charter schools, SELPAs, and county offices to deliver those services. So we're sort of the umbrella about ensuring IDEA. If you go down here to the special education guidance and you click on that, it says added March 20th. There's actually a newer post. This is our guidance for COVID-19. And these are really the most common questions that we've been asked. And so these have been, we've been using these, and we've also shared these with our SELPAs and our school districts. So they've also seen these. And I think it's a good idea for parents to also be empowered and know what to do in these situations. And a lot of this is based on the guidance that we initially got from the Office of Special Education Programs, which is our federal under the U.S. Department of Education, who oversees the Individuals with Disabilities Education Act. So I want you to look at that. Feel free to go back and look at that later. But I also want to bring you to one of our projects, and this is called, this is our Sipp, Supporting Inclusive Practices project. It's a technical assistance project that is one of our state technical assistance projects. And we'll be loading onto here over the next week a whole slew of resources that we cultivated and cured from 150 members that volunteered for the Superintendent's Task Force on Distance Learning, special education specific. And our Sipp partners, if you go down, we really have them in place to set up and to put forth technical assistance around inclusion, including all of our students with disabilities to the greatest extent possible in our schools and our communities, backward mapping to employment. And they're working with 50 school districts now, and we'll be providing, there's a bunch of resources on here that you'll be able to access, and keep checking back on it, because this next week we'll be putting a whole slew of additional resources. And then I also want to finally point out that we have a Facebook page, and if you haven't followed it, I recommend you do. This is, if you just put in the Facebook up here, California Department of Education, almost every day there's some type of webinar. Today was one for resources for students who are blind and visually impaired. There's a whole number of other ones that we've done around special education over the last 4 weeks that are also on this website. And then every day, I think at 9:30, the superintendent comes on and talks about things as well, about what's sort of the latest and greatest. So I'll go back to here. I hope that's helpful. And I'll go ahead, and I know we're running out of time, so I don't want to take up any more time except to leave for some questions, specific questions. And please know also, if there are any other additional questions we don't answer tonight, you are welcome to email me at sedinfo@cde.ca.gov, and I'll put it in the chat. That's our really our director's office. It goes directly to my staff, who answer questions around issues related to COVID-19. And if you have more general questions, there's a more general CDE one, but those are for the special ed questions in general. And I'll turn it back to you, Areva, and thank you so much for having me.
Thank you so much, Kristin, for that great presentation. And I want to thank you and Autumn both for making yourselves available and your teams available for any questions that don't get answered tonight. So we're going to get started. And Kristin Jacobson is going to start with a few questions, and then we'll take questions from our participants. Participants, you've been very patient, and thank you. We know how busy parents are. We know you have so many meetings and things to juggle. And again, we just want you to know you're doing a fantastic job. I think we can't say that enough to our parents and our community, how well all of us are doing juggling distance learning, getting dinner ready, keeping our house together, and many of us who are still working while we're juggling all of these things. So just want to let our parents know we appreciate you, we see you, and we affirm the great work that you're doing with your kids, who are, for the purposes of this call, our kids. So with that, Kristin, questions for you.
Sure, and I'll just do a very brief introduction. My name is Kristin Jacobson, and I run Autism Deserves Equal Coverage, a nonprofit helping kids access treatment for autism and related disorders, including a lot of mental health. I'm just going to be helping ask some questions here. I guess I wanted to start out it's a broad question, and I'd like to pose it to both Autumn and Kristin. We have had kind of a difficult history with autism and behavioral health treatment and ABA, where we have not easily fit in and been captured by, you know, the typical healthcare system and the typical school system. And we've had to have a lot of special legislation, special guidance. And I guess one of the things we're wondering is if you're open to kind of any sort of ongoing discussions about whether it might actually be necessary, because behavioral health treatment and autism is such a unique thing and actually has been declared by 2 state agencies as, you know, emergency services, equivalent of emergency services, that might we look at whether, you know, have some discussions around whether we might need some specific guidance that's actually specific to this. And of course, first we'd have to do some research, but I'd love to have and get some input and feedback, but I'd love to have both of your perspectives on whether the departments would be open to, you know, kind of looking into that.
Absolutely. I mean, I'll say on behalf of the CDE, we would be happy to, and we've been having a lot of really positive, collaborative conversations with Department of Healthcare Services. We're doing a big work group with them right now around Medi-Cal and how districts and schools can get better access to Medi-Cal and what the barriers are. And I think this definitely is at the top of mind for me and for us, because we do have a number of our population in special education that, you know, is the behavioral health pieces are very significant. And I think that is one of the reasons you'll see in some of the guidance that we put out that, that there is a caveat there around being able to provide districts to be able to provide support to protect the health and safety of our students. And that was sort of the thinking there, was that there are going to be students who need additional and significant support in order to keep them and their families safe. So I think we definitely would welcome a conversation about that and some ideas on how we can sort of, you know, so to give people a broader understanding. And I'll pass it on to Autumn to answer.
Thank you.
I would just say I agree. You know, we're always open to hearing from family members, providers, advocacy groups, where we can strengthen the delivery of healthcare services. You know, we're always open to input and welcome any specific suggestions that you have as we, you know, engage in future conversations. So absolutely would love to hear from you, and you all have my contact information. So we look forward to our continued partnership and future discussions.
And of course, we're hopeful that this is the first of you know, multiple, or at least, you know, the beginning of the discussion with, you know, our community and your agencies. So we really appreciate that response from both of you. A follow-up question: there was a lot of discussion about telehealth, but because of the specific nature of autism and related disabilities, and the key, you know, role that in-person services play when someone needs 24/7 care sometimes, or, you know, at a minimum, you know, maybe a 30 or a 40-hour a week in-person program. Like, for example, my son's getting his in-person ABA services, but I know that not everybody is. And I'm wondering if you have any thoughts, but that would be probably one of the most top of mind issues. I know personally there are a lot of behavioral health and mental health services that are being deemed, you know, in person and medically necessary and essential. And that's probably the first topic that our community would be interested in having as part of that group. And you may or may not be prepared to address anything about that now, but if you have even any thoughts or encouragement or sort of empowering advice that you could provide to the families, we would really appreciate it.
Yeah, so again, this is Autumn, and I would say that the primary advice that we would give is to talk to your provider, talk to your clinician about what's appropriate for care for you as an individual family with unique needs, right? So we can't make a blanket one-size-fits-all statement. We understand that. We have worked to make sure that telehealth is an option for delivery of services, but it's an option if it's deemed clinically appropriate by the provider. And if it's not clinically appropriate, then in-person visits are, you know, still allowed, even in the midst of the COVID-19 pandemic, with certain precautions. And there are, you know, a lot of concern about availability of protective equipment and other things that are necessary to keep people safe. But as time goes on, there will be more opportunities to continue inpatient, or not inpatient, but in person is what I meant, care for families who, for beneficiaries who really would benefit more from having that in-person interaction. And I know that everybody's story is a little bit different. So Kristin, thanks for sharing that you're continuing to receive in-person services. Other folks might be receiving their services via telehealth, and it really should be an individualized decision that whatever's best for the needs of the beneficiary in order to make sure that those needs are met. So our advice would be to talk to your provider about what's best for your child, for your family, and based on the needs that you have.
I guess, do you want to answer Kristin as well? Kristin Wright?
Yeah, so I think it goes back to sort of that individualized conversation again. There's nothing that's, aside from local orders, precluding a team from deciding, or a district from deciding to do in person, but that's something that's going to have to be weighed and is really a local decision. It's kind of like what Autumn said. We've tried to provide the highest level of flexibility, but understanding there's a lot of elements to consider depending on where you live and depending on what the situation is. So again, it kind of goes back to the individualized, but if I, for me, I would certainly, if something is not working, especially the tele distance learning piece, then it would be time to figure out something else, to the greatest extent a district could do that. So I know that's a kind of a vague answer, but it's really the truth, is that it's really in the local context. So the state's tried to provide as much flexibility without limiting districts. But I think the bottom line is the health ordinances sort of are prevailing in a lot of these situations.
So a follow-up question from someone in the audience, Marcia writes, if it's determined that in-person services are deemed clinically appropriate, who is responsible for providing the PPE? And I guess I would broaden it further to say, how are DHCS and CDE able to support providers who want to provide the services but are either unable because they can't get PPE, or they're unable because a particular health plan is saying they can't, or a particular school district is saying they can't, and maybe making a blanket statement rather than an individualized statement. And so, what if you could comment and answer that question, that would be appreciated.
Kristin, I'll defer to you in just a moment. I was just going to say that I know that making sure that there's appropriate protective equipment available for healthcare workers and for folks in essential service positions has been a primary focus of our governor, and he's been talking about that quite a bit on the daily briefings that he's been delivering related to COVID-19. There's a lot of information available on the California COVID website, as well as on the Department of Public Health website, around the availability of protective equipment. But certainly that is something that we've been focused on from the DHCS perspective for our healthcare providers, and working with our managed care plans to make sure that they do have the personal protective equipment that's necessary to be able to continue to deliver essential services during the public health emergency. So that's a fairly complicated answer, but it is a priority of the administration to make sure that PPE is available. It's also been a discussion. I don't know how many of you folks participate, but there's a weekly call through the Cal OES that is open up to providers and community members regarding making sure that people's functional needs are met, and PPE has been a big discussion there. So it's definitely on the top of the list of things that we've all been thinking about as we are talking about opening up the delivery system and opening up the economy. It's a big priority for our governor. So I know that, again, isn't a very specific answer, but it is a priority.
It's also something, it's been a big topic of conversation that our superintendent has been having with other school district and county superintendents, because that is a huge consideration when we're talking about reopening schools and what the protocols will look like. So that has been a big recent conversation about just what that would entail and what that would take. So I think that's unfolding. It's, you know, as you know, this hasn't been, it feels like this has been going on for just ever, but it hasn't actually been going on for that long. And everyone's been trying to pivot and now we're looking at, okay, now we're looking at summer and then we're looking at fall, and how do we back map into that? Because there are so many considerations and a lot of still unknowns.
A follow-up question to both of you would be maybe the second half of my question, which is, or back to the, I think the community is, I think, wanting to state that autism needs to be looked at through a different lens, because we really just don't look like anything else. We're not delivered in a hospital, so you can't get PPE the way they do. We're not delivered in a school, so you can't get PPE the way they do. And we're not delivered in a grocery store necessarily, you know, so, you know, or like an essential service like a pharmacy. So I think it's one of the areas where if you could talk about how you guys, or maybe it's one of the things we can put on the agenda for our, you know, autism or, you know, behavioral health specific topic. But, you know, what do we do when we look different and we are even sometimes not considered life-saving services, maybe what DDS is doing, even though the state has actually said that they are. So, you know, or at least both DMHC and CDI said that these are essential and can cause irreparable harm with delays. So
it's a great point, Kristin. It's really well taken, because I think you're right. And I think maybe one of the areas that we can look at is where are the places that it overlaps and where are the gaps. And so if we're talking about related service providers, we need to make sure that related service providers have access to PPE, right? That they're not, because they're private businesses, they kind of got caught up in being on contract with districts, but not actually paid directly from the state funds. You know, like there's been some things that didn't fit. Yeah, no, I completely get what you're saying. And so it would be a great conversation to have, that you need to put on, if you will, put on the list for us to talk about in our conversation about where are the gaps, because if we can cover where there are areas that we can, you know, that more broadly can be covered, like related service providers, then where else, right? Where else, what else are we missing?
Yep. I
would agree. I would agree with that, and look forward to additional conversation about how we can, you know, move forward and make sure that services are provided in the safest possible manner, including, you know, with PPE where appropriate.
Another question came in, and one thing I wanted to check is because the presentations were lengthy and excellent, we haven't had a lot of time for questions, so I just want to understand your availability so that I can make sure I feed questions to you and yet at the same time respect your time and the valuable time of the families as well.
It looks like you have a lot of people still on here, so I'm okay for a little while longer if Autumn is.
I can go a little while longer, yeah.
Okay, maybe we'll target like another 10 or 15 minutes, something like that. Does that seem reasonable? 10 minutes?
Sure.
10's great, yeah.
10's great. Okay, we'll end at 8:15. Okay, so the next question is, it seems, let's see, I have to read it, I'm sorry. Okay, it seems as though our school districts are not offering in-person services for any student, at least probably this person's school district. Only short period of group instruction. Has the state told districts that one-to-one aides are not allowed to work with individual students without online supervision by teachers and or work on individual goals?
No, it has not.
8:15 finished, sorry. No, it has not. And what about DHCS? Has DHCS issued anything that says, you know, insurance companies are not allowed to do that or anything like that? I'm not expecting the answer to be yes, but I think it's helpful for people to hear it.
No.
Okay. If there is one, say, school district in particular that is telling people across the board, we will not be allowing any either BHT services or in-person services, that they're clearly not individualizing it, is that the kind of an issue that we could bring to you? And is it at those contact numbers that you gave us earlier at the CDE?
Absolutely.
Yeah.
Okay. Some of the questions are in Spanish. I think I'd like to open it up to the translator.
I have a question. I have a couple of questions.
Go ahead, Areva.
Yeah, Autumn, you mentioned that certain pre-authorizations were waived. One of the questions is when a FBA is submitted to a Medi-Cal provider requesting that ABA or BHT be authorized, that pre-authorization, has that been waived given the state of emergency?
So prior authorization has been waived for the fee-for-service delivery system. We've also issued guidance for our Medi-Cal managed care partners, encouraging them to waive prior authorization requirements during the course of the public health emergency to align our delivery system. And so those, I'm sorry?
It's an encouragement. Is that what you said? I just want to make sure I understood, as opposed to a directive.
You know what? I probably have to double check on the language on that, but we have asked the plans to align with the fee-for-service policy, which is to suspend prior authorization requirements during the public health emergency. However, as I said before, treatment authorization requests and service authorization requests, if required for services, continue to be required even during the public health emergency, but could be submitted after services have been delivered. And so that's really just during this period of time. If there's a family or a child that has an existing authorization, we've also put out guidance that those existing authorizations can be extended so that children and families are not going through a reauthorization process in the middle of the COVID-19 pandemic. So that guidance is available. And again, as I said during my presentation, all of this specific guidance is hyperlinked into the presentation. And so you can take a look at it and get all of those details about the prior authorization policy, because it's a fairly extensive policy with specific directions for how providers should proceed. But if you have questions, we'll be happy to entertain those if you want to send me an email.
The other question relates to telehealth. So we know that the Medi-Cal providers, made the transition to authorizing telehealth for direct services. Can we expect those services to continue once the state of emergency is lifted?
Should the services continue via telehealth? Is that what you're asking?
Right. Will the providers continue to authorize the delivery of service via telehealth once, say, the emergency is lifted, kids are back in school, and we're out from under the shelter-in-place orders?
Sure. So the department has a long-standing telehealth policy as a part of our Medi-Cal provider manual that directs how telehealth or how services can be delivered via telehealth. And prior to the public health emergency, we'd adopted a fairly broad and comprehensive telehealth strategy. There are some things that are being allowed under the existing, under the public health emergency that would not be required under the kind of more traditional telehealth means, such as those kind of telephonic interactions, where it's literally, a cell phone to a cell phone type of communication. Our guidance on telehealth gives some specific examples of the type of services that are available via telehealth under our traditional telehealth policy that existed prior to COVID-19, and what's being allowed as a result of the public health emergency. And it does a fairly good job of distinguishing between what is always allowable and what's kind of a special exception due to the public health emergency. There's also, in addition to the policy guidance, we've added frequently asked questions about the provision of services via telehealth in all of those kind of circumstances, traditional and also as a result of the public health emergency. So again, that guidance is posted on the DHCS website and is fairly extensive, and services under certain circumstances are still allowed to be provided via telehealth once the emergency is resolved.
Okay, thank you.
I have a follow-up. Is that okay, Areva? Follow-up question? Follow-up question on specifically the question about what if an entire school district is not being willing to do something, and I'm going to go ahead and re-ask it, and at the risk of raising some ire from the particular school district. Long Beach is apparently one of the few that has just made a blanket rule that says we're not doing this at all. We're not allowing any behavioral health or any in-person services. I'm not even 100% sure which it is, but it's some sort of blanket statement. And what's the best way to proceed for that or any other district that does a similar policy?
Yeah, you can definitely reach out and let us know the situation. Like if you received something from the district or something, we're happy to follow up with them and see what they were thinking. I think at the beginning, some districts were, again, we thought this was going to be for a few weeks. So some of the decisions that they made, I think, had to do with this being a very short period of time, not considering that it would go to the end of the year. And so I think, districts are starting to now, we're all starting to come to terms with that this is going longer than we all had hoped it would. And so what do we do now? So you're always welcome to send any of your information to that SED info. If it's specific about, I'm just wondering about the school district. Now, if it's about a complaint, you can go ahead in the website that I showed you earlier, there is a parent helpline and complaint email that you can send an actual state complaint. But that would be if you think that the IDEA has been violated and you have a specific complaint that you would want us to investigate at a state level. And to me, that's typically a last resort because we want to make sure that students are getting what they need as soon as possible. So go ahead.
Another question from a parent who says their child was getting ABA services at a non-public school, and obviously school is out, but they've been having difficulties getting that ABA services in home. So what should they do to get those services that they were getting at the NPS now to have those services provided at home?
If they haven't already, I would request an IEP meeting immediately. And, like we heard in some of the other comments, some of the districts had initially sent out PWNs to say, we're trying to figure this out, this is what we're giving everyone right now. But I think that was initially for just a short period of time to bridge a gap, as opposed to thinking that was going to be long-term. So I would, if you haven't had luck talking to the individuals you usually work with your team, I would call a formal IEP meeting.
And we're getting some other questions like that. And I think, because there's a question here about the school district not providing flexibility. One of the formats is worksheets for speech and language. How do we address denials to provide therapy via Zoom? And I would assume the same answer is to request an IEP, or is that?
Yeah, I mean, it is, yeah, you can request an IEP meeting, but if you think that someone can help solve it, like if it's an issue around, if it's a district policy now that they're not using a certain platform or another, then that has to be worked out definitely locally. But I think the key here is access, right? So we want parents and families to have access to it. If the district's doing distance learning, the bottom line is everyone has to have access to distance learning. And that may look different for a kid with an IEP. Like if a child's not able to access things in certain ways, then we need to figure out a way that they are. The equity piece of this is everyone gets education. If you're doing distance learning, there shouldn't be anyone left behind.
And I'm just trying to rapid fire these questions because I know we're going to let you go.
One more that I want to do after you do. I have just one last question that's on one of these that was submitted.
Okay, so this one is about extended school year. A student doesn't have it but needs ESY. The family and IEP team meets. The team disagrees and offers nothing during the summer. Does the family have due process rights still? And what do they do in the meantime?
So again, I think that's an individual case, but extended school year, the purpose of extended school year isn't remediation under COVID, right? The purpose of extended school year has a different statutory purpose to continue something that's been, and for most districts, extended school year will just continue what they're doing through distance learning. So if a family believes their child needs extended school year, they need to call an IEP meeting. And if the IEP team
disagreement, they have to go to due process.
They do. Yep.
All right, great. Go ahead, Kristin.
One last question, because I know it's just 2 minutes past 8:15, so I'm going to do this last question unless Areva has one more, but I know the panelists requested. what can DHCS and CDE do in terms of getting information directly to families, other than directing them to the website? Is there any way that they could consider, asking either the NCOs, the fee-for-service, or the school districts to send out any sort of general, to every special ed student or any student as an IEP or a 504, or, to send it to all their beneficiaries saying like, you still have your right to an IEP, because it's really hard for families to get the kind of access. And it was really helpful to have you show us where on the website, but for many families that don't have access to that, and they may still only have, the ability even to get a piece of mail or something like that. What other suggestions do you have, or can we put that on the agenda for how to get information to families directly?
So one of the mechanisms we are using, and I just did a big town hall with the parent training and information centers. And so the parent training and information centers, which are our federally funded centers, as well as our 14 family empowerment centers, FECs, we are in contact with all of them, and they also are able to provide these same resources and have had training on the guidance that we've put out as well. So they're all aware of everything that, that we're saying and doing, and they're answering calls with parents all day, every day. And so for those who are not connected with their family empowerment center, California Family Empowerment Centers, or parent training and information centers, those are also, you can just Google them, and then there's a map that shows you where they are and the contact information for them.
And this is for you, Autumn, one of the questions from an anonymous attendee, but this is a question I think all agencies have. Does DHCS have any programs or funding available to help providers who had just a huge number of cancellations due to COVID concerns? I know there was a question when we had the town hall with DMHC about whether those cancellations could be paid, since in theory, the services had already been pre-authorized by the carrier. So there was some question about why should the carriers get to keep that money and benefit from the cancellations that were due to COVID-19.
And you mean the carriers in terms of the managed care plans? Is that?
Yes, so the managed care plans, the Medi-Cal.
So I just wanted to make sure I understood your question, but unfortunately there is not funding available in most cases for providers for services that were not delivered. However, I will say that each managed care plan negotiates with their provider network separately from the Department of Healthcare Services, and they have some of their own flexibilities to work with providers in the delivery of services. Unfortunately, though, under the Medi-Cal program, there are rules and requirements that require services to be delivered in order to be reimbursed. There are some limited exceptions, and as I spoke about earlier, under the Home and Community-Based Services DD waiver, the Department of Developmental Services was able to secure retainer payments for some providers to deliver who traditionally deliver habilitation services because of absences and other things. But we continue to work with CMS on flexibilities that are needed. So if there's a specific request, you can certainly submit, for consideration to us, but there's not a specific program for funding of providers.
And just to be clear, Autumn, you're saying that's a CMS call, that they made the call at the federal level, that they will not provide providers with reimbursement or for payment for those COVID-19 cancellations?
There are some flexibilities that are available for certain types of services, like habilitation services, for the state to provide retainer payments. And those flexibilities were approved as part of the Home and Community-Based Services DD Appendix K waiver. Those are some of the things that we talked about earlier in my presentation, but there's not a kind of an at-large program. There are a lot of things that the department has been doing to help to assist providers and make sure that providers are continuing to be providers after all of this is over with. We understand that that's a particular concern, that, in some sectors and some providers are really impacted by just the lack of services that are happening, the inability to get reimbursed. The economy is going to have a big impact, and we do understand that. And so where we can have some flexibilities or increase, look at rates, how rates are developed, and how we work with our managed care plans to make sure that that's kind of filtering down to providers. Certainly there are some things that we can do, but there's not an overall kind of program like you were referencing in your initial question. So there are some flexibilities, but certainly if you have specific suggestions or recommendations, we're open to your input.
All right.
And I'll also caveat that the fiscal is not really my area of expertise. And so any questions that you can send in related to fiscal components, we can share with our fiscal experts at the department as well.
All right, I think we are well over our 8:15, stated termination time. And I just want to thank you, Autumn and Kristin, for your service. We know this is a difficult time for everyone. We know that our state is a model for the rest of the country, that Governor Newsom has done an outstanding job. I don't think all parents and all families agree with all the decisions that are being made, but that happens all the time. But in general, I think the state of California has done a really great job in one, obviously flattening the curve, keeping our cases contained, really, keeping the deaths, which has been just so catastrophic around the country, keeping ours at, one death is one too many, but definitely we haven't seen the kind of death rates that we've seen in New York and some other big states. So we know that you too are playing a role in keeping families safe during this difficult time, and we appreciate your time coming onto the call and all the work that you continue to do. So on behalf of all the participants on Special Needs Network and all the co-sponsors, again, thank you for your time and thank you for being a part of tonight.
Yeah, really thank you on behalf of Autism Deserves Coverage as well. I mean, this was really outstanding, and we look forward to the opportunity to continue to work together, and we'll make sure we sort through the questions that didn't get answered, and we'll send them over to you. And we're happy to be sort of intermediaries and go-betweens between our community and your agencies, because I know it's really hard to get calls from hundreds of people, and so we can try to help facilitate that for you.
Thanks for all the awesome work you guys are doing out there as well. Much appreciated.
All right, thank
Absolutely.
you.
Thank
Bye,
you.
parents and providers. Thanks so much for joining the call. Check Special Needs Network's website for future web events such as this and all the other programs that we're offering throughout the shelter in place and throughout this health crisis. One thing we know for sure is that we will get through this and we'll get through it together. So thanks, guys. Bye-bye.
Thank you, everybody. Bye.